Why do spines degenerate? Hi, I'm Dr. John Shim, and this is a common question asked by many of my patients. I hope you had a chance to already view my basic spine anatomy video, as that foundation will make it much easier to understand this spine degeneration discussion. To simplify how the spine degenerates, we must make some basic assumptions. The degeneration is the result of aging, not a traumatic event or known medical condition. As you know, the spine is composed of the functional spine unit, the so-called vertebral body sandwich, with the intervertebral disc being the center of the sandwich. For this discussion, we will focus on an intervertebral disc. The disc is composed of two main components. The center is the nucleus, the outer section is the annulus fibrosus. Current day research indicates the water-filled nucleus changes as we age. There are specific proteins that have a water-capturing property. When we're young, the protein called proteoglycan strongly pulls water, keeping the nucleus full of water and maintaining its height and strength. If you MRI most healthy teenagers, the MRIs will show that discs are full of water, and as a result of the water pressure, the disc walls, or the annulus, are straight. The disc height is full and tall. There's plenty of space in the foramen, and the nerve has lots of room to safely exit the spine without any concerns for pinching. As we age, the body starts to produce a different form of proteoglycan. To simplify the discussion, each time the small cells in our bodies divide to produce another generation, it loses a bit of a marker called a telomere. As we lose more and more of these telomeres, our resultant cells start to change. The resultant cells in the spine and in the cartilage will produce a different proteoglycan. The proteoglycan for aging spines will not have the same water retention properties as younger cells. As a result, the disc is less full of water, the disc height reduces, the water pressure on the annulus lessens, and the annular walls start to sag or bulge. Yes, this is the disc bulge process. As the disc height reduces, the forces on the facet joints of the spine also change. There's more excursion of the facet joint, and the facet joints may start to slide further against each other. This leads to wear of the cartilage of the facet joints. Because of the wear of the facet joints, it can be a painful process, and the body reacts to decrease the joint forces experienced by these individual facet joints. It reacts by enlarging the facet joint surface area. This facet joint enlargement or hypertrophy is a process how bone spurs form that pinch the nerve as they exit out the foramen. Not only is the height of the foramen hole decreased by the shorter disc height, but the facet joints that are located in the back of the foramen enlarges and also contributes to narrowing of the space for the nerves before exiting out the spinal canal. As the discs lose its water content, the disc bulge also contributes to the narrowing of the central canal space of the thecal sac or nerve tube, causing another area of pinching of the nerves. The narrowing of the space of the nerve is the spinal stenosis process. In addition to narrowing of the space caused by bulging of the disc and the hypertrophy of the facet joints, there's also enlargement of the ligaments between the vertebral bodies. The ligament that most enlarges is the ligamentum flavum. To understand how this happens, imagine stretching a rubber band. When it's stretched, it thins. When the rubber band is no longer stretched, it thickens. The ligamentum flavum is a ligament that's stretched by a tall, well-hydrated disc. But when the disc shrinks because it loses water content, it no longer stretches the ligamentum flavum. As a result, it thickens. This thickening can contribute to the narrowing or the spinal stenosis condition. While I'm oversimplifying the process, I hope you can now understand how the aging process of the spine begins with disc degeneration changes of the proteoglycans. It causes disc height shrinkage, leading to facet hypertrophy, disc bulging, and ligamentum thickening. This all leads to spinal stenosis, facet arthritis, and hypertrophy. This process is called a degenerative cascade. Thank you for staying with this video, as this degenerative cascade process will help explain many of the pains experienced by many of my patients. Thank you.